Regular cleaning and maintenance are essential for both your health and the machine's performance. Follow these care instructions to help ensure that your therapy remains effective. Clean your mask daily, each morning, using a soft, damp cloth. Be sure to wipe the interior and exterior of the mask. Never use alcohol-based cleaning agents to clean the mask, as these can damage the mask material, causing it to harden and crack. If the mask is visibly soiled, use gentle soap and water to wash it, then leave it to air dry completely before reattaching it to the machine. This is to prevent any water from entering the machine, which may cause a short circuit. You may clean the exterior of the machine using a damp cloth every morning. For safe and hygienic humidifier use, empty the humidifier chamber each morning and refill only with cool boiled water or sterile water to the recommended level. This reduces the risk of bacterial growth. The BiPAP machine requires annual servicing to ensure optimal performance. Please schedule yearly maintenance checks with your vendor and contact them directly for any machine repairs, mask replacements, or technical support. Upon discharge, the ward clerk or staff nurse will book an appointment at the SKHNIV clinic or the patient's preferred institution. Remember, proper care of your BiPAP machine is crucial for effective therapy and your overall well-being. If you experience any issues with your machine or need replacement parts, contact your machine vendor. If you have any concerns about your NIV therapy, please contact your respiratory therapist before discharge.